My name is BrittanyWhite. I am a dental hygiene student at Concord Career College in Memphis, Tennessee. Today we are going to be going over 5 instruments, which is the 1112 Explorer, the periodontal probe, the Gracie 1112, as well as the Gracie 1314 and the 204S. With each instrument, we are going to be determining the parts of the instrument, the correct working end of each instrument, as well as the correct use of each instrument and where each instrument should be used in the mouth. So the first instrument that we're going to do is the 1112 Explorer, and we are going to determine the appropriate ends of the instrument. This instrument, as well as every other instrument, has a handle from here to here, which is where you would correctly hold the instrument. You have the shank, which is from the handle up. You have the terminal shank, which is the last bend of the instrument, and then you have the working end of the instrument. The next instrument that we are going to be using is the Gracie 1112. As like the 1112 Explorer, this has the handle, which is from here to here, the shank from here to here, and then the terminal shank from here. But this instrument is different and is like the future instruments that we're going to be using, as this has a cutting edge to it. The next instrument will be the Gracie 1314. It has a handle from here to here, the shank from here to here, and then the terminal shank from here to here. It also has a cutting edge as well. The next instrument will be the 204S, which has a handle from here to here, a shank from here to here, and a terminal shank from here to here. This instrument has 2 cutting edges, which allows you to use both sides of the instrument. And for this demonstration on the probe, I'm going to use the 1112 Explorer to correctly identify the parts. Our probe at Concord Career College has a probe on one end and a shepherd's hook on the other end. We will not be going over this end, we'll just be looking at this end. So it has a handle, and our probe has 3 millimeter increments, which is 3, 6, 9, and 12. So from here, we're going to be taking the instruments into the mouth to show how to correctly use them and where they're going to be used in the mouth. I did not demonstrate this, but this is a mirror. This helps you in the mouth by increasing your indirect vision, your direct vision, your transillumination, as well as your illumination. So I'm going to be focusing on quad 2. So while I'm in this quad, I'm going to have to use this mirror in my non-dominant hand, and you're going to use a modified pen grasp like this while it is not in use. And I will still have to correctly fulcrum while using this instrument. That way I can keep the mirror secure to where I can see when I'm using an instrument to not cause harm to the patient. The first instrument that we'll be using today is the 1112 Explorer. This is used subgingival to detect calculus. You want to use light pressure with some lateral pressure to be able to detect the calculus. The end of the instrument will actually vibrate when it detects something subgingivally because your eyes cannot see that. So you want to make sure that you always have a light grasp on the instrument, and as our instructor said in clinic, that they should be able to come over at any given point while we're using the 1112 Explorer and take it out of our hand. That is how light of a grasp we should have on this instrument at all times. This instrument also is different because it does not have a cutting edge on it. It is very thin. Also, with using light pressure, it will help you not to bend or break the instrument. This instrument can be rotated as well as flipped to properly be used in the mouth correctly. So I'm going to demonstrate how you would find the correct working end for the quad of the mouth that you are in. So for video purposes, we will be in quad 2. You have your mirror in your non-dominant hand, making sure that you are still using a fulcrum. And we're going to go to the premolars And the way you test this instrument is that you have, in between the premolars, you want to make sure that your terminal shank is parallel, and when the terminal shank is parallel, the handle will be coming out of the patient's mouth. Now I'm going to flip it to demonstrate what it will look like when you do not have the correct working end. You'll have it in between the premolars, and when you have the terminal shank parallel, as you see, it is going back into the patient's mouth. So we're going to flip it so we have the correct working end. For this instrument, you want to start on the most posterior tooth, making sure that you have your middle finger on the shank, your ring finger as a fulcrum. You're going to start distal, line angle, and go distal, making sure you come all the way up into the contact, which this does not have an opposing tooth, but you still want to come all the way up almost until the occlusal edge. You will take it, rotate it on the toe of the instrument, start back at the distal line angle, and go distal, line angle, mesial, doing walk-in strokes, making sure you keep the instrument adapted all the way into the contact and approximately. And then you are going to go on to your next tooth, starting distal, line angle, distal. You're going to come up into the contact, start distal, line angle, and go mesially. You're going to do this all the way from your most posterior tooth, which in this case will be tooth number 16, all the way until you get to the first premolar in quad 1, which will be tooth number 5. Once you get here, you will flip your instrument, and for this I will be in direct vision, so I will palm my instrument. You will have a correct fulcrum, start distal, line angle, distal, distal, line angle, mesial, and follow back through. So for the next instrument that we're going to use is the probe. Now this instrument is used to measure the periodontal pockets as well as clinical attachment loss. Clinical attachment loss is where when a patient has recession, you would measure from the point of the CEJ, which on this tooth right here is super erupted because it lacks the opposing tooth. So you would measure from the CEJ to where the beginning of the gingiva starts. And then from there you would measure from the gingiva to the base of the sulcus. That is your clinical attachment loss. This instrument is also the only instrument that you can use your fingers to move. Every other instrument has to have wrist movement. You also have to have 6 measurements per tooth. You have 3 on the buccal, 3 on the lingual. You want to make sure that you get to the base of the pocket, and a lot of times it's kind of scary because you're going into the gingiva, but you want to go until you meet resistance. Once you meet resistance, that's when you know you're at the base of the pocket. So now I'm going to show how to correctly use the periodontal probe in the mouth. And as you see, the patient is not correctly at my position, so I'm going to move the box as if it was a patient, and I would ask them to rotate their head towards me, or I would move my body to the correct clock position so I can correctly adapt the instrument to the teeth. I'm going to be using my mirror with a fulcrum. I'm going to start at the distal line angle, and I'm going to go distally in walking strokes using my fingers to adapt the instrument. And then I'm going to, without coming out of the sulcus, rotate back and go distal line angle to the mesial, all the way in approximately, adapting the probe to the contour of the teeth. And that is the only tooth that you have to go distal line angle distal before progressing to the mesial. So for the next tooth, I'm just going to jump out of the sulcus right back in at the distal, and I'm going to walk all the way to the mesial. And then all the way into the contact, and then so forth with the following teeth. The next instrument that we're going to be going over is the Gracie 1112. This is used for posterior teeth, which is from premolar to molar, and the 1112 is used for the mesial surfaces of all posterior teeth. This instrument also has a toe instead of a tip, which causes less trauma when you're inserting and removing calculus subgingivally, which is below the gingiva. So I'm going to show you how to correctly find the working end. We're going to be using the premolar test on this instrument as well, making sure you have your fulcrum. You are going to go in between the premolars, and when the terminal shank is parallel to the premolars, the handle will be coming out of the patient's mouth. Like with the 1112 Explorer, I'm going to show you what it looks like when you have it adapted incorrectly. You place it in between the premolars, and when you have it parallel, as you see, it is going into the patient's mouth. And it also causes your wrist to be in an incorrect ergonomic position. So we're going to flip it. And like I said, this instrument is used on mesial surfaces of posterior teeth. So we're going to start on number tooth 14 because it's easier accessible. You are going to insert it into the gingiva, and you're going to do short walking strokes around the tooth, just on the mesial surface. And you're going to make sure you come all the way through the contact, just that way if you have something that is on the gingival margin and where the actual tooth comes out, you can break it free. So next tooth, we are going to start at the distal line angle, work our way mesially in through the contact, and come up. Now, if you happen to come into a piece of calculus, you're going to want to first get underneath the piece of calculus. You're going to move your instrument out just slightly, that way you can have the cutting edge underneath it, and you're going to pull up and pop it out, making sure that you are using lateral pressure and you have a strong fulcrum. If you have a piece of calculus and you do not get correctly underneath it and you are just scraping it, you're going to burnish it, and it will be smooth to where you can't adapt your instrument and pop it off. Now, that is it for this instrument. The next instrument that we'll be going over is the Gracie 1314, which is pretty much the same exact way as the 1112, except this is for posterior teeth distal surfaces. Now, when you're using two area specific instruments, you want to make sure that you overlap, just like you did with the 1112 Explorer, you overlap the distal line angle, so you do not happen to miss a piece of calculus that is directly on the line angle. With this instrument, we're going to use the premolar test as well. We're going to start here. As you see, this instrument is parallel now, and the handle is coming out of the patient's mouth. We're going to flip it, that way you can see the incorrect use. You see when you parallel, the handle is coming into the patient's mouth. So we're going to flip it, that way we can correctly use it. Making sure you have your strong fulcrum. You're going to enter into the sulcus, do walking strokes, making sure you adapt the instrument and coming all the way through the contact. Next tooth, start at the distal line angle, making sure that you overlap the strokes from the distal line angle mesial and distal line angle distal. Do walking strokes. Use some lateral pressure, that way you can feel it. As you hear that sound right there, that is a piece of calculus. So you would adjust your instrument, that way you can get to the base of the calculus, and you would pull up and pop the calculus off. The next and final instrument that we are going to be using is the 204S. This has a tip on it, which means that it is used supra. This is a scaler. It is used on posterior teeth, but is much like the 1112 Explorer. This instrument will rotate as well as flip. You have two cutting edges on this instrument, which allows you to use it like the 1112 Explorer. And to test this instrument, you're going to use an interproximal test. It doesn't matter what tooth you have, just find a tooth for the sake of keeping everything similar. We're going to use the premolars. You're going to put the terminal shank in between the premolars. And when the terminal shank is parallel and the instrument is coming out of the patient's mouth, you know it is correct. We're going to flip it and have it parallel, and you see how far this instrument is coming into the patient's mouth. You cannot correctly use an instrument when it is like this. This instrument is also where when you're using it, it looks wrong, but when it looks wrong, it's right. So we're going to correctly go to the end that we're going to be using. You're going to start at the distal line angle and go distal, keeping it above the gingiva because it has a tip, so it can cause trauma. Go up into the contact, and then once you have came into the contact, you are going to start distal line angle with overlapping strokes on the distal line angle and come mesially. Next tooth, you're going to start distal line angle, distal, come interproximal. As you see, when you are interproximal, the terminal shank is parallel. You're going to come out, rotate it, go distal line angle, mesial, walking strokes, and when you come interproximal, as you see, the terminal shank is parallel again. And that is all we have for today. I hope this helps clarify some things and making your online learning experience a little bit better. And I hope you have a great rest of your term, and good luck.